Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College. I'm also Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, December 5th, 2022. The COVID 19 pandemic has had severe and far reaching repercussions for health systems, economies, and societies. Countless people have died or lost their livelihoods. Families and communities have been strained and separated. Children and young people have missed out on learning and socializing. Businesses have become bankrupt, and millions of people have fallen below the poverty line. COVID 19 has affected people differently. Most infected people develop mild to moderate illness and recover without hospitalizations. But the impact of COVID 19 on mental health cannot be underestimated. The burdens associated with COVID 19 have both brought on new mental health issues and disrupted existing mental health care providing services. Today, I'm going to talk about the impact of COVID in mental health, signs and symptoms, and policy strategies that have been adopted to address COVID induced mental health issues. I will follow that with a follow up on weekly statistics of new cases, hospitalizations, and deaths, both nationally and in Tennessee. During the COVID 19 pandemic, concerns about mental health and substance abuse have grown, including concerns about suicidal ideation. In January 2021, according to a survey conducted by the Kaiser Family Foundation, 41% of adults reported symptoms of anxiety and or depressive disorder, a share that has been largely stable since. During the pandemic, adults in households with job loss or lower incomes report higher rates of symptoms of mental illness than those without job or income loss. In a survey from June 2020, 13% of adults reported new or increased substance use due to coronavirus stress, and 11% of adults reported thoughts of suicide in the past 30 days. Suicide rates have long been on the rise and may worsen due to the pandemic. Early 2020 data show that drug overdose deaths were particularly pronounced from March to May 2020, coinciding with the start of the COVID pandemic. In addition to increased anxiety and depression, job loss may lead to other adverse mental health outcomes, such as substance abuse disorder. A Kaiser Family Health Tracking poll conducted in mid-July of 2020 found that compared to households with no loss of income or employment, a higher share of households experiencing income or job loss reported that pandemic-related worry or stress caused them to experience at least one adverse effect on their mental health and well-being, such as difficulty sleeping or eating, increases in alcohol consumption or substance abuse, and worsening chronic conditions. Many essential workers have faced a number of challenges as well, including greater risk of contracting the coronavirus than other workers. Compared to non essential workers are more likely to report symptoms of anxiety or depressive disorder, starting or increasing substance use, and suicidal thoughts during the pandemic. The Kaiser Family Foundation Health Tracking Poll also found that many adults are reporting specific negative impacts on their mental health and well-being, such as difficulty sleeping at 36%, eating at 32%, increase in alcohol consumption or substance abuse at 12%, and worsening chronic conditions at 12% due to worry and stress over the coronavirus. As the pandemic wears on, ongoing and necessary public health measures uh, expose many people to experiencing situations linked to poor mental health outcomes such as isolation and job loss. The Kaiser Family Foundation health tracking poll conducted during the pandemic have also found that people with lower incomes are generally more likely to report major negative mental health impacts from worry or stress over the coronavirus. In December 2020, 35% of those earning less than $40,000 reported experiencing a major negative mental health impact, compared to only 21% of those with incomes between $40,000 to $90,000 and 17% of those making over 90,000. In addition, the pandemic has disproportionately affected the health of communities of color. Non-Hispanic Black adults and Hispanic or Latino adults are more likely to report symptoms of anxiety and or depressive disorder than a non-Hispanic white adult. Historically, these communities of color have faced challenges accessing mental health care. Young adults also have experienced a number of pandemic related consequences, such as closures of universities and loss of income, that may contribute to poor mental health. During the pandemic, 56% of young adults ages 18 to 24 reported symptoms of anxiety and or depressive disorder. Compared to all adults, young adults are more likely to report substance abuse, almost double, 25% versus 13%, and suicidal thoughts, over twice as likely at 26% versus 11%. Prior to the pandemic, young adults were already at high risk of poor mental health and substance use disorder, though many did not receive treatment. Research undertaken during the pandemic points to concerns around poor mental health and well being for children and their parents, particularly mothers, as many are experiencing challenges with school closures and lack of childcare. Women with children are more likely to report symptoms of anxiety and or depressive disorder than men, at 49 versus 40%. In general, both prior to and during the pandemic, women have reported higher rates of anxiety and depression compared to men. Throughout the pandemic, adults in households with children under the age of 18 compared to adults in households without were more likely to report symptoms of anxiety and or depressive disorder. Among households with children under the age of 18, women have been more likely than men to report symptoms of anxiety and or depressive disorders throughout the pandemic. While many parents with school-age children are now more concerned about their children's emotional well-being than prior to the pandemic, women with children are more likely than their male counterparts to report worsening mental health. Both those newly experiencing mental health or substance abuse disorder and those already diagnosed before the pandemic may require mental health and substance use services, but face additional barriers because of the pandemic. Since the start of the pandemic, mental health service providers have tried to mitigate service disruption, for example, by delivering care via alternative routes when public health and social measures were in place. Community-based initiatives were often faster to adapt, finding innovative ways to provide psychosocial support, including through digital technologies and informal supports. In the United States, a number of steps have been taken at both the federal and state level to address the pandemic's impact on mental health. But with mental health problems on the rise, key issues are likely to persist. Congress has addressed some of the acute need for mental health and substance use services through two stimulus bills enacted during the pandemic. The Consolidated Appropriations Act, which was signed into law in December of 2020, included $4.25 billion in funding for mental health and substance use services. It also built on existing legislative efforts to boost insurer compliance with federal mental health parity rules. The Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, a stimulus bill passed in March of 2020, was also allocated funding for mental health and substance abuse services, including a $425 million appropriation for use by SAMHSA, in addition to several provisions aimed at expanding coverage for and availability of telehealth and other remote care for those covered by Medicare, private insurance, and other federally funded programs. It also allowed the Department of Veterans Affairs to arrange expansion of mental health services to isolated veterans via telehealth or other remote care services. Other efforts to address mental health needs include substantial increases in the use of telehealth for mental health services, aided early on by the federal government and many states expanding coverage and relaxing regulations for telehealth services. Looking ahead, the Biden administration and Congress could take additional steps to address mental health and substance use issues, including administrative actions addressing suicide among LGBTQ youth, mental health parity, the opioid crisis, veteran mental health services, and school based mental health services. Given the pandemic's implications for both people with new or pre pandemic mental health conditions, the crisis spotlights new and existing barriers to accessing mental health and substance use disorder services. Among adults reporting symptoms of anxiety and or depressive disorder, more than 20% report needing but not receiving counseling or therapy in the past month during the pandemic. Limited access to mental health care and substance use treatment is in part due to a current shortage of mental health professionals, which has been exacerbated by the pandemic. The pre pandemic shortage of psychiatric hospital beds has also worsened with the surge of COVID-19 patients needing beds at hospitals across the nation. For people with insurance coverage, an increasingly common barrier to accessing mental health care is a lack of in network options for mental health and substance use care. Those who are uninsured already face paying full price for those and other health services. As unemployment continues to affect millions of people who in turn may lose job based coverage, some may regain coverage through options such as Medicaid, COBRA, or the Affordable Care Act marketplace, but others may remain uninsured. Looking ahead, the pandemic has both short and long term implications for mental health and substance abuse, particularly for groups at risk of new or exacerbated mental health disorders and those facing barriers to accessing care. Phased COVID-19 vaccinations are taking place across the country, perhaps signaling that the end of the pandemic is on the horizon. However, many of the stressful conditions employed to mitigate the spread of the coronavirus are likely to persist for the near future, given the slow and troubled rollout of vaccinations across the country. Instances of people refusing the vaccine due to fear or uncertainty, and the need for vaccinated people to continue taking existing precautions to mitigate the outbreak. History has shown that the mental health impact of disasters outlasts the physical impact. suggesting today's elevated mental health needs will continue well beyond the coronavirus outbreak itself. For example, an analysis of the psychological toll on healthcare providers during outbreaks found that psychological distress can last up to 3 years after an outbreak. Due to the financial crisis accompanying the pandemic, there are also significant implications for mortality due to deaths of despair. A May 2020 analysis projects that based on the economic downturn and social isolation, additional deaths due to suicide and alcohol or drug misuse during the coronavirus pandemic may occur through 2029. As, as policymakers continue to discuss functions or further actions to alleviate the burden of the COVID-19 pandemic, it will be important to consider how the increased need for mental health and substance use services will likely persist long term, even if new cases and deaths due to the novel coronavirus subside. Now, nationally, COVID cases, hospitalizations, and test positivity are all rising at the national level, suggesting that the relative stability seen this fall could be coming to an end. Over the past 2 weeks, COVID cases have increased 28% nationally from 42,000 to 52,000 per day, or to 16 per 100,000 of the population. However, it is particularly concerning to see hospitalizations and test positivity, the most reliable data, rising sharply. Over the past 2 weeks, hospitalizations also have risen 28%, and test positivity is up from 13% to 18%, both very concerning numbers. Paradoxically, average daily deaths continue to decline from 260 to 250 over the past 2 weeks, a rate of 0.08 per 100,000 of the population, suggesting that the high levels of immunity from prior vaccination or infection are reducing the severity of impact of COVID. Good news indeed. The percent of the population remains vaccinated remains the same. In Tennessee, the number of new reported cases of COVID-19 continue a dramatic decline over the past 6 weeks, down 21% over the past 14 days. Hospitalizations, however, are up 36% over the past 2 weeks from 398 to 541 per day, while deaths are also up from 1.3 to 1.7 per day, or to 0.03 per 100,000 of the population, almost 3 times what it was in the previous 2 weeks. The low case count may be due to reporting delays from the Thanksgiving holidays. While there remains no county in Tennessee that's in the CDC red zone, there are now 17 counties in the yellow zone, up from 4 counties 2 weeks ago. Counties in the yellow zone include 3 of the counties that are in northeastern Tennessee, while 14 counties are now in central Tennessee, with none in West Tennessee. Includes the entire Nashville metropolitan area. For now, this is Dr. Paul Juarez from the Tennessee SEAL in HealthWorks at Meharry, wishing you a blessed and happy holiday season. Be safe.